Hi, I'm Doctor Mayank. I'm a board certified plastic surgeon, a diplomat of American Board of Hair Restoration Surgery, and founder Crown. I have been performing hair transplants for the past 14 years with over 5,000 odd transplants that we have performed. And we had started a series of talking about what could be a kind of grade of baldness that you may be suffering with. And if you have not seen the previous video, do check out the video of a grade 2 and 3 which we had recorded before. Today, we are going to talk about a grade 4 Norwood classification. So let's talk in detail what exactly is a grade 4, and if you are suffering from a similar grade, you might as well get in touch with us to understand what are your options. In grade 4 hair loss, what we see is that the frontotemporal recession on both the sides goes extensively just parallel to the perpendicular which we draw around the ear. So on the sides you would see that the recession is going almost till the level of the tragus, that is the front part of your ear, and from this area you would see a recession where the forelock thinning would also be there. Along with that, an amount of thinning of the crown may start, or the vertex part also may start in this area, which could be a part of your grade 4. A grade 4A is something which is an atypical grade 4, where the recession and the forelock part is totally missing, but this recession exceeds the level of your ears. And similarly, you would not see any thinning in the crown. If either of these grades is what you are looking at, let's talk about few cases who came to us with similar conditions. So this is a gentleman who was at an age of close to 48 to 50 years, where the recession of the hairline and the thinning of the forelock is something which you can see. This is just a single hair transplant with approximately 3,500 or 3,800 odd follicles which we have implanted, creating a natural looking hairline for him at his age with a single procedure. On both the sides you can see that the recession that has happened is something that is taken care of. On the other side as well, and now because he is close to someone who's at 50 years of age, I have not made his temples look like a kind of an aggressive coverage. This is somewhere where we have covered this entire area, and you can see that it is beautifully merged along with the native hair what he had. Another gentleman who had a frontotemporal recession along with the forelock thinning, again a natural looking hairline. On both the sides you can see that it has been created and merged along with the rest of his existing native hair. This is something which needs to be taken care of. The hairline cannot be made to look very unnatural. It is not something which is very aggressive. It is made conservatively as per the age and the candidature of a patient. Again, the top view of the gentleman as well. So in this area of the crown, you can see some amount of thinning. We have not done any transplant in this area because he was just 32, 33 years of age at this time and had not tried the medications to cover this area. So post medication, it has improved to some extent, which can always be addressed over a period of time to cover up. If you are at a young age, maybe someone who's at a younger age than 30 years of age, never jump in for a transplant of the crown to get that area covered so that there should be no part which is visible. This is a circle which is going to expand over a period of time, and whenever this expands, you will have the transplanted hair in the center and the baldness expand around it like a horseshoe shaped ring, which looks even more unnatural and worse. It is better to try medical treatments for this area. Sometimes even PRP, if you have miniaturized hair, may help along with the other medications of finasteride, minoxidil to improve the crown area extensively for about 70 to 80% of the patients. So never jump in for a transplant at a young age for getting this part covered. The frontal area where you've lost the definition of your face and there is amount of thinning along with that, it makes sense to do this. Why I'm saying this is because clinics normally would charge based upon the number of follicles that they're going to implant on your scalp. The more area of coverage that you are going to ask for, they are not going to talk to you. Most of the clinics may not even talk to you ethically that this is not the right age or stage where you should get the crown transplanted. So don't fall prey to these things. Be very careful about how you plan your procedure. Be aware about what needs to be done and what is the right time for you to get in terms of the transplant done for which area of your scalp. Another top view of a patient who was at 28 years of age. Again, we have done the frontal coverage along with the frontotemporal recession covered. The forelock gaps that were there, we have filled it up, and the midsection gaps also we have filled up. Now the crown area, you have seen the kind of improvement that is there from this to this just in 7 to 8 months. This is something which has just happened with the usage of medications and PRP. So as I mentioned, be very cautious about how to plan the procedure. At the end, you may not see the difference or the kind of the transition that is from the transplant to the crown area because it is a tapered density what we implant. So this area, even if medically improves, you may not see a lot of thinning or gaps over there. Another patient with the frontotemporal recession along with the forelock thinning where we have done the transplant. Again, you can see the hairline is very conservative, looking very natural and beautiful. It is not something which can be identified as a transplanted hairline, which is actually the kind of end result that we look for all our patients. The top view of the same patient, again you can see that we have covered the frontotemporal junctions, we have covered the gaps in the forelock area also what he's having, and covered some aspect of the midsection as well. Again, this part we have not addressed. This is just medications which has improved. This is not even PRP along with medicine. This is just medications which has improved the crown also extensively for the patient. Another patient with a diffuse pattern grade 4. So there are different subtypes of the kind of grades that we see. It's not always a classical picture what you would have. That's why don't try to typecast your grade yourself. Always talk to your qualified experienced surgeon who's going to do that for you and tell you what is the kind of treatment line that you should be thinking about. This gentleman had been on medications for an extensive amount of time but was not seeing much results, following which we had done a transplant, and you're seeing the kind of transformation that we have achieved for him within a span of 4.5 months. So again, we have not tried to make the hairline look very aggressive. It is an irregularly placed hairline, beautifully curated and merging with the existing hair. And obviously you cannot make out where the transplant has been done against the forelock that was already there for him. Similarly, on the other side, you can see that this hairline has been made in a format that it should merge with the native hair, not making it look very flat or unnatural for his age. Another gentleman who had a diffuse pattern hair loss of a grade 4 with vertex also involved, where we had just done the front and the mid coverage in this surgery, following which we had performed another surgery for him a few years down the line for his crown coverage as well. But you can see that it is almost merged beautifully along with the rest of the hair. Now, if the expectation of a patient is not to make the hairline look very aggressive or make it very low, then it can be given a beautiful natural appearance with a receded hairline as well, so that it looks as per the expectation what you have in your mind. But the same gentleman, if would have asked me to create a hairline right here at the middle of the forehead, obviously it is an unrealistic expectation which you should definitely not fall prey to. The top view of the same person where we had not transplanted the crown, you can see this area. It is improved with medications, but obviously not as thick as the front and the mid which has been transplanted. Another patient with a diffuse pattern grade 4, similarly created. You can see that the frontal area has been added with an extensive amount of density and the mid coverage also has been done. Crown had not been transplanted, which has again improved with medications. So these are some of the cases which I think would give you a fair idea about what a grade 4 male pattern baldness could look like and what are the kind of results that you can expect out of it. Beautiful hair transplants should give you a beautiful hairline. It should look natural. People should not be in a position to identify which part was transplanted and which is the area where you had your native hair. It should merge beautifully into those existing hair. So if you have a grade 4 male pattern baldness, I would request you to contact the numbers given below so that we could have a chat and we could discuss what are your options and maybe we could help you out. I hope you liked this video, and if you did, please do subscribe to the channel and like this video as well. Thank you so much.